Today we have our support group meeting. I call it Tuesdays with Teresa. And this is an opportunity for the head and neck cancer survivors to gather together to support one another and for us to provide information and education and really just to kind of help them put their lives back together.
People forget. They think you're cured of the cancer, you look good, you're not ill, so they forget about that. And it's like they don't understand that you can look good on the outside, but it doesn't mean that things are working properly on the inside.
I've seen a lot of different patients, many of whom have never smoked or drank a day in their life, and yet have had 80% of their tongue removed. So my specialty is really in treating swallowing disorders because that is a common occurrence following head and neck cancer treatment. The survival rate is actually quite high now, but the disability it leaves them with most commonly is really difficulty swallowing. And for many of them, the ability just to return to some sort of semi-normal way of eating and drinking is a huge accomplishment.
Multiple types of cancers, which are very similar, have been kind of grouped together within the head and neck region. It's a very tricky area to treat. The cancer in itself is kind of targeting an area which is kind of vital to who the person is, their identity and who they are, and because of that, the treatment can be very complex. Also, your goal obviously is a cure, but at the same time you got to take into effect what you're going to be doing to the patient afterwards and what's the best management and goal between the two of them.
The whole thing is ours. They don't use the word cure, they don't even use the word remission anymore. They use the word no evidence of disease. So I'll take whatever they said.
Ben came to me with 80% of his tongue removed. And in order to reconstruct something that looks like a tongue, they had to take quite a bit of tissue from his abdominal wall and reconstruct it. He's really unable to speak, he was unable to swallow, but Ben, I think, has been amazing in his ability to communicate, and again, he was unable to swallow anything at all when he came to me and now can at least manage small amounts of foods.
So this is my dream kitchen. I'm French, so I could French cook, cuisine, but I do any kind. But Ben cannot eat, he cannot swallow. So I just don't cook that much. I have two gorgeous ovens that I put side by side, and I just don't cook that much.
This is C. Hello, my name is Carlo Diaz. I am a survivor for the last 18 years. I have been through many different physical experiences and still wrestle with problems such as swallowing, eating, talking and hearing. I am very stubborn and will not allow anything to give me a negative position, nor will I give into this recovery process.
Communication and socializing with your friends and family are important. This and my phobia make my world easy.
Carl had received radiation therapy many, many years ago. He's unable to swallow, so he does have a feeding tube, and he is really unable to communicate very well at all. Probably one of the best things we were able to do for Carl was to give him an alternative or an augmentative communication system, which allows him to be able to communicate in ways that are completely understandable to anyone around him.
Historically, the thought was that the head and neck cancer was driven primarily because patients would have a tendency to smoke, and then with that, alcohol consumption and drinking. However, a new type of cancer has arisen that sometimes a virus, human papillomavirus, has been associated with the head and neck. And because of that, it's changed who gets this type of cancer. You don't have to smoke, you don't have to drink to develop this type of cancer.
How you doing, friend?
I'm exhausted, but...
Here you go. Alright, you guys are up.
Have fun.
I consider myself a fairly tough guy. I spent 35 years in the American Merchant Marine. I've seen and been all around the world, but this is the most terrifying thing I've ever had to do. Once your mask is on and it gets you screwed down to the board, you ain't going anywhere. It's like being nailed to a cross.
And this is where the radiation is going at once you start the machine.
It's really scary for me to see that happening to somebody else, even though it happened to me 3 years ago. It's very traumatic.
And then at lunchtime, I get the lunch business. This is where I live down here.
That's not a good stretch.
So that's the ocean, the Atlantic Ocean, Hampton.
Oh my gosh!
So like 8 of the 10 of them sunk like.
It is brother's wedding.
And my cousin's wedding. My cousin's wedding.
But we've known each other.
Hello, Teresa. It's Bob. I'm here
Hey, Bob. How you doing? Good to see you.
Well, thanks.
Good. You doing okay? Good.
Yeah.
Hug. How's everything?
Everything's good.
Good, good, good. Liz, I want to retake your measures today, and then we'll get you on the table and get working on you, okay?
Okay, very
All right,
good.
great. All right, so I'm going to measure and see how you're doing here. We are measuring the degree of fibrosis. Fibrosis occurs following radiation and chemotherapy. So we're at 28 millimeters. Normal would be maybe 6 or 7. So Bob, I'm going to go ahead and lie on the table here. I use a lot of manual therapy on my patients and techniques to help actually reduce this, and so far the results, the outcomes have been quite excellent. So Bob, how's the eating going?
Good.
Yeah? What are you eating and drinking these days?
Well, I like steak.
Yeah.
It takes a long time to eat it. I gotta cut
Yeah.
out real small pieces, chew it a lot.
That's great. It's unusual. Not a lot of patients after radiation therapy can eat steak, so that's a huge accomplishment for you. So a lot of what I do is very fairly unconventional for a speech pathologist, but not at all unconventional for a physical therapist. Nothing I'm doing is unique in the sense that it's not a recognized technique from a physical therapy standpoint, just a little different from a speech pathologist standpoint. So Bob, were you able to eat and drink during your radiation therapy?
In the beginning, but then no.
And that was because of why?
Well, my throat was cooked.
Yeah, your throat was cooked if you couldn't hear that. So Bob, how does this feel?
That's nice.
Yeah. Yeah, nobody ever complains. Did everybody get a chance to introduce and meet yourselves and meet yourself? Did everybody get a chance to meet yourselves?
The understanding, the love, the friendships that we've made here.
The human element does not understand that they also they take it for granted. And we understand each other and have compassion. We don't hold hands, but it's here for you. And we share, and we look at each other, and we say, never, the earth died, and the earth's trying to make it.
The good news is that this is a very treatable cancer. You just want to catch it early. If you catch it early, then you're not going to have these more serious side effects that we've discussed. So be aware. Be aware of anything that doesn't belong in your mouth or on your neck, and have it checked out, and maybe have it checked out by more than one specialist.
I'm a cancer survivor from HPV cancer, and I'm grateful for the group that I go to.
My name is Joy. I'm happy to be able to eat and swallow.
Hi, I'm Bob. I'm a cancer survivor and very grateful to be alive.
Had a great day today, and I'm looking forward to tomorrow.